All of the following are associated with clinically significant blunt renal injuries in adult patients and would warrant further evaluation, except A. A sudden decelerating mechanism of injury in a patient without microhematuria. B. A sudden decelerating mechanism of injury in a patient without shock. C. Gross hematuria. D. Microscopic hematuria. E. Microscopic hematuria in a patient with shock. Answer is D. Microscopic hematuria. Renal injury requiring intervention is rare in the absence of gross hematuria or shock. Gross hematuria warrants careful evaluation for significant genitourinary injury, although the degree of hematuria does not necessarily correlate with the degree or grade of injury, and significant genitourinary trauma can occur without hematuria. Microscopic hematuria in a blunt trauma patient without shock is not an indication for renal imaging, even if there is evidence of local trauma, for example, costovertebral angle tenderness or localized ecchymosis. Although renal injury may uncommonly be identified on imaging for these patients, the injuries are mild and do not require intervention. Hemodynamic instability with evidence of intraperitoneal injury on abdominal examination, presence of pelvic fracture, a penetrating trauma mechanism, or presence of lower rib fractures, with or without hematuria, are indications for further investigation. Additionally, imaging is advisable for patients with gross hematuria targeted to the entire urinary tract or localized to the lower tract, bladder and urethra, depending on the mechanism and location of the trauma. A 27-year-old male presents after a motor vehicle collision complaining of abdominal pain. He was the restrained driver of a car struck on the driver's side by a delivery truck. His vital signs are blood pressure 118/72, heart rate 70 beats per minute, and respiratory rate 16 breaths per minute. Physical examination reveals left upper quadrant abdominal tenderness without guarding or rebound tenderness. There is no blood at the urethral meatus or scrotal hematoma. A Foley catheter is placed without difficulty and drains gross blood. A radiograph of the pelvis reveals fractures of the left superior and inferior pubic rami, and a focused assessment with sonography in trauma examination reveals free fluid in the splenorenal pouch. Which of the following diagnostic strategies is most appropriate? A. Intravenous contrast-enhanced computed tomography of the abdomen and pelvis with delayed images of the bladder after clamping the Foley catheter to allow the intravenous contrast to collect in the bladder. B. Intravenous contrast-enhanced CT of the abdomen and pelvis with delayed images of the renal collecting system. C. Intravenous contrast-enhanced CT of the abdomen and pelvis and retrograde CT cystogram. D. Intravenous contrast-enhanced CT of the abdomen and pelvis and retrograde urethrogram. E. Retrograde cystogram followed by intravenous pyelogram. Answer is C. Intravenous contrast-enhanced CT of the abdomen and pelvis and retrograde CT cystogram. This patient has clinical features concerning for several possible injuries, including a splenic laceration, renal injury, and bladder rupture. Significant urethral injury is less likely, given the examination findings and ease of Foley catheter placement. Because the patient is stable without apparent indication for laparotomy, the most appropriate diagnostic evaluation would be intravenous contrast-enhanced CT of the abdomen and pelvis and retrograde CT cystogram. Contrast-enhanced CT of the abdomen and pelvis and retrograde CT cystogram. The former will evaluate for solid organ injury and the latter for bladder rupture. It is essential that cystography not be done in an antegrade fashion, because such studies, for example, inject intravenous contrast-enhanced CT of the abdomen and pelvis and retrograde CT cystogram contrast material, clamping the Foley catheter, and allowing the examination to depend on antegrade filling of the bladder from renal excretion of progressively dilute contrast material, may produce incomplete and spurious findings because of inadequate distension of the bladder. A 72-year-old male presents with flank and pelvis pain after he slipped and fell on an icy sidewalk. His examination reveals normal vital signs and abrasions over the left flank and left iliac crest and is otherwise unremarkable. He has grossly clear urine, but a urinalysis reveals 25 red blood cells per high-power field. Radiographs of the pelvis and hips reveal no fracture, and the patient is able to ambulate without difficulty. What is the most appropriate next step? A. Obtain a renal ultrasound scan. B. Obtain an intravenous contrast-enhanced CT of the abdomen and pelvis and retrograde CT cystogram contrast-enhanced CT of the abdomen and pelvis. C. Perform a retrograde cystogram. D. Perform a retrograde urethrogram. E. Treat the patient's pain and discharge him home with outpatient urology follow-up in 1 week. Answer is E. Treat the patient's pain and discharge him home with outpatient urology follow-up in 1 week. A significant genitourinary injury is unlikely given the patient's history, physical examination, and urine findings. However, outpatient urology follow-up until microhematuria has cleared is advisable to be certain that it does not represent another more serious underlying, non-traumatic condition.